everybody. I don't know if there's anybody on. I was hoping to maybe try a YouTube live to answer any breastfeeding questions that moms might have that might be on right now. I want to make a video about plug ducts and mastitis, but I kind of thought that I might try a YouTube live first just to see if there are any questions or anything that I could help answer, and if not, then I might go ahead and talk about the differences between a plug duct and mastitis and how you know if you have one or the other. So I'll just, I guess, go ahead and talk about that, and then if I see anybody come on and ask any questions, I'll try to take the time to answer those. So what is a plug duct and what is mastitis? And basically you aren't going to get mastitis without having a plug duct first. And a lot of times the reason for a plug duct, which basically is exactly what it is just a milk duct that is plugged that is blocked, and it can cause extreme pain. Sometimes it can be not as painful as others, but it could be painful. And the best thing you can do for a plug duct is to pump or to breastfeed. It is painful while you're pumping or you're breastfeeding, but it's really, really important to do so to try to get that duct clear. Another thing that you can do for a plug duct is a lot of times just kind of going, it sounds kind of funny, but breastfeeding on all fours. So like if you get on your hands and your knees, have the baby underneath you, something about gravity helps pull that milk down and out and through those ducts. So sometimes that can help. It kind of sounds funny, and the picture of it might sound kind of funny, but it does actually help with the gravity. Now, mastitis is when that plug duct is not being emptied, has not cleared, and it then becomes infected. Sometimes it can happen like simultaneously, where you get a plug duct and at the same time you get mastitis. So it's almost like the infection, everything starts all at once. So you don't have like a plug duct and then time passes and all the, you know, you're not clearing it. So it could be sometimes that, but just most of the time it starts with a plug duct. Okay, I'm sorry I missed your question. I'm having baby number 4 in 5 weeks. Will my mature milk come in faster this time around? Yes, usually with my baby number 4, I wasn't even out of the hospital yet and I had my milk. So usually every time you have a baby, your milk comes in a little sooner, usually within 24 hours. So like I said, I hadn't even left the hospital with my 4th, actually with my third and my 4th. I hadn't even left the hospital yet. My mature, well, yes, your mature milk is in. It's still going to be mixed with colostrum. Yeah, within 20, I know, it's amazing, but your body kind of knows what's happening. And so, excuse me, it happens quickly. It comes quickly. But again, you know, if it's not there within 24 hours, again, you know, waiting up to 3 days. I don't know what happened with your first, your second, and your third, but going based on those is always best. You know, if it doesn't come in faster than the others did, don't worry about it. Like, you know, it's normal for it to take up to 3 days. But yes, with each of mine, it was a little quicker. The other thing that I noticed with each of mine is while you're breastfeeding, the cramps that you get, that tends to be a little more painful every baby that you have. And I don't know if you've noticed that, if you're going from your 4th to your 5th, you said. So I don't know if you noticed that with your previous, but you can kind of expect that as well. So on day 3 with, or like 5 days, okay, yeah. And that's the thing too, sometimes it can be if you have like a C-section, sometimes it can take a little bit longer, or certain medications can cause it to take a little longer. So so yeah, you don't want to, you kind of just base it on that 3 to 5 day mark, and that's why we always just say your milk matures. We don't like to say your milk comes in on day 3 to 5 because we're trying to teach moms to understand that they already have milk. It's just that, like you mentioned, the mature milk doesn't actually change and become more until between day 3 to 5. But yes, it can come in sooner with each baby that you have. And usually you can tell by the fullness of your breasts, as well as sometimes you'll see milk dripping out of their mouth. But again, you may not see anything at all. And I don't know what happened with your first four, right? You said you're going on baby number 5. So I don't know what happened with the first 4, but every time is different. But I would kind of go based on your previous experience. So if it was 3 days, okay, you're going to number 4. I'm sorry. So yeah, so if your baby number 3 came on your milk came on the 3rd day, then it possibly still could. But yes, it can come in sooner than that. Just because your body knows what it's doing. So since there isn't, it doesn't look like there's anybody else on and no other questions, I was talking about the differences between a plug duct and mastitis, and the best way to avoid a plug duct is by breastfeeding as much as possible. And so if you're breastfeeding very often, then you're less likely to get plug ducts. Another reason why you could get a plug duct is if the baby is not emptying the breast. So if you're feeding and you still feel like there's milk left in the breast, sometimes that can cause plug ducts. So a baby's not latching correctly or just not able to get all that milk out. So sometimes if you pump after to make sure the breast is empty, it can help to be sure that you don't get plug ducts. I wouldn't overly worry about getting plug ducts or pumping or emptying the breast if you've not had a history of it, but especially for a mom who has a history of plug ducts, to just make sure her breasts are empty after each feed so that she doesn't have to worry about that. And it tends to happen in that first month because babies and moms are learning to breastfeed, and that can kind of cause the issue with the mom learning to know and understand how the breast should feel before a feed and after a feed to know if it's good and empty. And so plug ducts tend to happen around that time period. It can also happen like if the baby doesn't feed as often, maybe they're sick and they're not feeding as much, or maybe you're away from the baby a little bit more, so plug ducts can happen for that reason. And again, mastitis, you will have flu-like symptoms, pain in your breast, your plug duct. And whenever you have flu-like symptoms, if you're breastfeeding, it's always good to go see the doctor to make sure to rule out mastitis, because that does need to be treated. And you definitely need to continue to breastfeed when you have mastitis. Some doctors will say to stop breastfeeding, and that is the worst thing for you to do. You at least need to be pumping if you're not breastfeeding. But as long as baby, the antibiotic that you get put on is safe for the baby, which they can make sure that you're on a safe antibiotic, then you should be able to continue to breastfeed. And if for some reason you do not continue to breastfeed, at least pump, because the only way you're going to clear that duct is by getting that milk out. You don't want to make it worse. So that's kind of like what I wanted to talk about. If I didn't get any more questions, but this is actually just it's the first time I've done a YouTube live, and I might try it more often. But I kind of thought, well, you know what, I'm sitting here, and for the first time since the kids got out of school, they're not surrounding me, and so I figured, let me take this few minutes and just try a YouTube live. That's why I don't look the greatest. I've been out in the sun swimming and everything, so I'm without makeup and not looking the best, but I thought I would put out a video. So thank you very much for your question. I think it was simply Kiki, is that how you pronounce it? Thank you for your question. And if you don't have any other questions, I will end the video and talk to you guys again soon. Good night.